sounded the alarm on the growing menace of quackery within the traditional medicine sector. At a recent stakeholder engagement in Accra, the council expressed deep concern over the risks posed by unqualified practitioners to the lives of citizens.
Traditional medicine, which involves the use of herbs, roots, bark, and minerals to treat various ailments, is a vital part of Ghana's healthcare system, but poor standards and a lack of enforcement of regulations have compromised treatment quality. Currently, there are over 40,000 traditional medicine practitioners in the country. The council, during a stakeholder engagement to tabulate the emerging threats to practitioners, says it's determined to ensure that traditional medicine practice meets the required standards to protect the public. Chairman of the council, Professor Atu Duncan, emphasized the need for a proper code of conduct among practitioners, assuring that key interventions were being implemented to sanitize the system.
Roll out a nationwide registration audit to update our practitioner database and weed out unqualified operators. Deploy mobile inspection teams in all regions to support compliance with good manufacturing practices for herbal medicines. Establish a continuous professional development scheme, that is CPD, which we already have, with mandatory refresher courses on safety, pharmacovigilance and ethics.
Registrar of the Council, Dr. Yakubu Yusuf, expressed particular concern about the proliferation of psychic healers in the system.
The level of quackery is on an unprecedented level and poor standards. Proliferation of unauthorized online traditional medicine practitioners, these we are all aware. I was in a Volta region and one of the psychic healers got up to complain that he, as a psychic, there are certain terminologies that shouldn't go into people's ears. But this today, it's on social media, it's on TikTok. Everybody is hearing it. This is his space. He most likely knows what he's talking about. But he says there are certain incantations that shouldn't be in the public domain. So it's a concern we have to address aggressively.
The Health Minister, Kwabena Mintah Akando, would also want the practitioners to collaborate in unity and adhere to the standards of the practice.
And so statistics show that more than 70% of the population are used to this approach. And therefore, there is the need for us to capitalize on this to, one, grow the economy and to create more employment whilst we are healing people in this country. And before we can do that, the fundamental thing that we all need to do is to come together as one people. And so let's adhere to standards, let's be united, and let's try to invest in the sector. This sector can play a significant role in the 24-hour economy.
The council hopes to integrate traditional medicine into the national healthcare system, making it a complementary and effective part of modern healthcare. Sarah Penko, TV3 News, Accra.